peptides can be great to help with wrinkles, but there's so many different ones out there. The best part is you can get some of the most effective anti-wrinkle peptides without a prescription. But the problem is there's so many, and certain skin peptides are way more effective than others when it comes to wrinkle treatment. Hi, I'm Dr. Morgana Colombo. I'm a board-certified dermatologist out of Northern Virginia and founder of Vida Derma, a science-backed skincare line to help women as they age. Today, I am going to walk you through the top 3 peptides for wrinkle reduction that you can find over the counter. I'm going to explain what each one does, how to use it, and what the research actually shows when it comes to wrinkle reduction. Let's start with the basics. Peptides are short chains of amino acids, the building blocks of proteins. Your skin is made mostly of collagen, and collagen is a protein. As we age, collagen production slows down, and that's a big reason why wrinkles form. Certain peptides can signal your skin to ramp up collagen production or relax the tiny muscle movements that deepen lines over time. So here are the top 3 peptides for smoothing out wrinkles. Number 1 is palmitoyl pentapeptide 4, which is also known as Matrixyl. Matrixyl is one of the most well-studied cosmetic skin peptides available. It is a fragment of type 1 procollagen, the same protein that gives your skin its structure. When applied topically, it acts as a signal peptide, essentially telling your skin cells to produce more collagen types 1 and 3, as well as fibronectin, which supports your skin's framework. In a 12-week double-blind placebo-controlled study of 93 women, a moisturizer containing Matrixyl at just 3 parts per million showed a significant reduction in wrinkles and fine lines compared to placebo. And here's something I find interesting as a dermatologist. Unlike retinol, Matrixyl did not disrupt the skin barrier or increased water loss from the skin. That makes it a great option if your skin is sensitive or easily irritated. So that's great for women in perimenopause and menopause. You will find Matrixyl in many serums and moisturizers, from affordable brands like The Ordinary to higher-end ones like Olay Regenerist. Our Vida Derma Age Erase and Phytoester Age Eraser also have Matrixyl in it. Look for it listed as palmitoyl pentapeptide 4 on the ingredient label. Number 2, when it comes to skin peptides you can get over the counter, is acetohexapeptide 8, which is better known as Argireline. This one works differently than the previous one. Instead of boosting collagen, Argireline targets the muscular junction, the connection between your nerves and your facial muscles. It interferes with a protein complex called SNARE, which is needed for your nerves to release the chemical signals that make muscles contract. In simple terms, it gently relaxes the small, repetitive muscle movements that can cause expression lines, like crow's feet and forehead wrinkles. That's why you will sometimes hear about this called the topical Botox. Now, to be very clear, it's not as powerful as Botox, but there have been clinical studies which have shown that a 5 to 10% Argireline solution can reduce wrinkle depth by up to 27% after 30 days. A more recent clinical study also showed significant improvement in both static and dynamic wrinkles after 12 weeks, with improvement in skin smoothness, firmness, and elasticity as well. The recommended concentration is at least 5%. You can find standalone Argireline serums or look for it in combination anti-aging products. Our Vida Derma Eye Refresher has some Argireline if you want some improvement of eye wrinkles. Number 3 is called GHK copper or copper tripeptide 1. This is a naturally occurring peptide found in your own blood plasma, and its levels decline as you age. GHK has a strong affinity for copper ions, and this copper complex plays a role in wound healing, collagen remodeling, and even antioxidant defense. In placebo-controlled facial studies, GHK copper creams applied twice daily for 12 weeks reduced fine lines and wrinkle depth, improved skin density and thickness, and enhanced skin clarity and firmness. One study even found that GHK copper outperformed both vitamin C cream and retinoic acid in stimulating collagen production in skin biopsies. You can find GHK copper in serums like The Ordinary's Buffet plus copper peptides. One important tip, avoid using copper peptides at the same time as direct acids like glycolic or low pH vitamin C serums. Acidic environment can destabilize the copper complex and reduces effectiveness. If you use both, apply them at different times of the day. At Vidaderma, we're currently developing a really great serum with GHK, actually without the copper. Stay tuned. Now, a few practical tips for getting the most out of peptide products. First, concentration matters. Many products don't disclose exact peptide amounts, so look for the peptide listed early in the ingredient list. That generally means a higher concentration. Second, packaging matters. Peptides can break down in heat and light, so choose products in opaque, airless pump bottles rather than jars or clear containers. Third, peptides are generally very well tolerated. Across clinical trials, adverse events have been minimal, making them a great option for sensitive skin type, including women in perimenopause and menopause where skin becomes more sensitive because of estrogen loss. One thing I always tell my patients, peptides are a complement to your skincare routine, not a replacement for the fundamentals. Sunscreen remains the single most important anti-aging product you can use. And if you're looking for the strongest proven topical anti-aging treatment, prescription tretinoin is still the gold standard. But peptides offer a gentler, well-tolerated addition, especially for those who can't tolerate retinoids. As always, guys, your skin is unique. What works best depends on your skin type, your concerns, and your overall routine. If you're unsure where to start, talk to your dermatologist or, go to our site and take our quiz. If you found this helpful, give this video a like and a subscribe. For more evidence-based skincare advice, drop a comment below and let me know what other topics you want me to cover. Thanks for watching and I'll see you in the next video.